Welcome to the STEM Road Podcast. I'm Jerry Cabrera, President and CEO of Elevate Southwest, and this podcast host. In each episode, we'll talk with an industry expert who shares their career experiences and insights, and we'll also introduce a student who is starting their own journey in the same or similar field, providing a fresh perspective on the future of the industry. Our mission is to uncover the diverse pathways to success in post-secondary education, providing inspiration and guidance for anyone interested in STEM careers. So join us in the STEM Road as we explore the remarkable journeys of those paving the way and elevating the future of STEM. Welcome to the STEM Road Podcast. My name is Jerry Cabrera, President and CEO of Elevate Southwest, and my co-host,
Melina Conroy, Chief Operations Officer.
And this episode is about movement, medicine, and making a difference in people's lives. And we have two great and special guests. We have Camila Macias from physical therapist. Actually, it's Yuma Orthopedic Physical Therapy, right?
Yes, correct.
And Andrik Reyes, who was a summer intern, and he is from Cibola.
Yes.
So we're going to start off with Camila, so she can introduce herself and a little bit of history of how she got into physical therapy in itself.
Hi, Jerry. Hi, Melina. Thank you for having me. It's been awesome and an awesome experience to be here with you guys. Kind of taking it back from my childhood, I got into physical therapy from a very early age. I got some exposure. I always knew that I wanted to help people. So first and foremost, I was kind of between teaching and medical school, or probably going in to be a doctor. And so after a few kind of career days at school and also some injuries that I went through as an athlete in high school, I really started to get some exposure to what physical therapy is and how physical therapists help people day-to-day recovery, not only athletes, but just anybody with any type of pain or limitation. So after that, I just followed that same path, followed my education, got a lot of volunteer experience, and then kind of made my way into, both my bachelor's program as well as grad school. Growing up here in Yuma, it makes me really happy to be here with you guys and to have this experience and kind of give back to the community through these internship programs.
Thank you very much. It was great to hear that. Obviously, you're from the region. And so at what, I don't want to say age, but was it at high school, college that you decided, you had to change your majors?
So kind of for physical therapy, the road always has to be grad school. The thing about the physical therapy degree is that it's changed over time, many, many times. It's interesting because it started around the time of World War I, kind of in the early 1900s. And what a lot of people don't know is that it's largely predominantly women that started this. As soldiers were wounded in war, women were taught to not only be their nurses, but also go through the road of recovery. So since then, these programs have developed not only in terms of a bachelor's program, but then a master's in the early, I want to say 1990s. And then the first actually doctorate program started in about 1996. So we've been kind of growing the profession. It's been, just growing and growing, and the degrees and the level of preparedness has exploded since then. So when I started looking closely into it, I graduated with my bachelor's in psychology. And then I went into my graduate DPT program, which is a doctorate level degree.
Wow. I want to go back to that, but we have to introduce Andrik.
Melina, Jerry, thank you guys for having me. Camila, it's good to see you again. I'm a junior at Cibola High School. I had the internship over the summer with Camila at YOPT. I would have to say it's a really good experience. I mean, the things that you guys do at Elevate is very beneficial to our youth. I learned a lot with Camila, just the communication skills with patients, just kind of having that compassion towards patients, helping them through their struggles, because sometimes you'll get different levels of patients. You'll get patients who are in extreme pain, who can have very little movement when they first start off, and then they'll have, by the end of their therapy, they'll have complete movement. It's kind of just really good to watch them progress.
So you're a junior, right? You're just starting your junior year at Cibola. And, you still have a few years to kind of figure out what career path you want to go on. But as of right now, where does that stand for you? What are your interests, or where do you see, yourself going? What kind of program or school do you see yourself going into after high school?
Well, right now, I mean, before the internship, I was really interested in going to some kind of surgical field in medicine. But I mean, the internship kind of really just made me think about what I could do in physical therapy. I mean, I've been an active member of our sports medicine program at Cibola, and I mean, it's just really hard, honestly, really hard to choose between surgery. I mean, you get the communication skills with physical therapy, you get the patient interaction, which honestly, I mean, that's for me is something I really enjoy, just engaging with patients and just being able to help them out. But surgery for me is just, I like the complexity of it, at the skill level.
And that's why I wanted to go back to what you stated. Exactly what he's going through right now is, trying to juggle and figure out what he wants to do. But what's important, and we had these discussions in the past episodes, is keep an open mind to see what doors open up, right? Physical therapy did open up, and there might be start there and the possibility, right? And going into orthopedic or something to that nature. But I love to see that these are STEM careers. And I think working at your place was hugely, obviously makes a huge difference. But it's interesting to see that from, like I did and Melina did, it was, we had that open door and trying to figure out, well, from what you were doing to now, obviously physical therapy.
Right.
So did now that you actually have a business, looking back, what do you see, or what could you have changed?
I think I wouldn't have, I don't have any regrets, Jerry. I don't have anything where I'm like, I could have done this differently or better, because even in those moments that are tough, or even in those moments that ourselves as workers or as students, we feel like we didn't do our best or we failed, that opens up the door for more opportunities. And those opportunities are to learn, right? So many times when the door closed on me, and not necessarily, hey, I got what I wanted, or I got into, my graduate program right away. It wasn't until the second time I applied that I got into this program. So the first time, it opened up the door to another possibility to travel, to get to see the world, to get to see how physical therapists work in other countries. So I got to take a wonderful trip in my early 20s to Kenya and see how therapists manage patient care and work with very limited resources. Stuff that I still consider to this day with my patients that have limited resources in Yuma County, where they don't have money to buy equipment. They don't have a lot of things so we're dealing with all different social classes and economic classes in our practice. So that just gives me that experience to build on now as a professional. So.
Wow, that's fascinating. And also, I didn't know that your bachelor's was actually in psychology. And so I think that's really interesting too. I think that there's a lot of skills that we can gain in different degrees and certificates that you can obtain throughout the years, but that you can apply those into many different fields. I know that there's different paths, right? So you did your bachelor's in psychology, but I know there's other areas, right? You guys also work with physical therapist assistants. So I kind of wanted you to go a bit more in detail. What are those different paths that I guess there could be many, but what are kind of the more standard or typical paths for somebody that might be interested in a career in physical therapy?
And also, if you can include the certifications as well.
Yeah, definitely. So many times, starting from the lowest in terms of patient care. So I'm not going to be touching on the, kind of receptionist or secretarial or management positions in a typical clinic or in a typical setting. But definitely starting at the lowest level, we have our PT technicians. So it can be either a trained position, but anything in terms of exercise science background, personal training background, some type of certification, and that is always very useful. And when not, we can definitely offer that training and train our technicians to kind of help us kind of guide and, again, kind of follow the protocol that we set out for every patient. So that can be anywhere from entry level, kind of like minimum wage, to anything above minimum wage. And then my assistant, so the physical therapy assistant position, I believe they have an associate's level degree, and I think they also offer bachelor programs ranging from 1.5 to 2 to 2.5 years. So again, we're talking about the cost of tuition, right? So those programs are a lot more affordable for people, offering also increased salary and benefits included to that. And the difference between that and what I do, which is a doctorate level, they wouldn't be able to directly evaluate or see a patient. They could kind of carry on kind of the initial program that I set, and they could make some changes with my approval, of course, and communication. So a lot of collaboration between the 2 degrees and the 2 programs. Of course, when we're talking about a doctorate level program, we're talking about grad school. So these programs range probably from 3 years to 3+ years, depending on the structure of it. And there's a highly clinical component, which means that in the last year, you're pretty much working already at that point under the supervision of an already licensed physical therapist. So you're working, you're learning, and you're also taking it back to school, depending on the structure of every program. Again, collaboration is huge. And again, that comes at a cost. But fortunately, there are a lot of scholarship opportunities, tuition assistance, and things like that to try to bring the cost down. I tell everybody I meet, it's like, I don't regret it at all. It's like student loans and student debt is a part of it as well. But, if you like what you do, if you don't dread going to work every day, it's a great opportunity.
I like what you mentioned in terms of try to make sure that there's no barriers, right? We all have barriers that we have to go through in life in general. But one thing, yes, is finance. It could be transportation. It could be other types of barriers. But that shouldn't, in a way, stop you from, pursuing your dreams. So, Andrik, what are your dreams, aspirations, as you learned, obviously, physical therapy? You're trying to figure out in terms of the type of medicine you want to go into. So what are your aspirations, dreams? What school do you want to go to? Obviously, you had a great counselor here. Yeah, that she's been obviously guiding you. So what are those?
Well, for sure, medicine. That just these summer programs just kind of reinforce that. But as of dreams, I would really like to go out of state for college. Arizona has very good programs for medicine. I know U of A, they have a very good medical program, but I just want to go to the East Coast. The East Coast, I know Columbia, for example, is an Ivy League. It's a dream to go. Their medical program is really good. But again, it goes back to considering what I want to do, physical therapy or surgery or whatever, right? It really just comes down to which program is going to be able to facilitate that.
So, but the real question is, are you coming back to Yuma?
I can foresee that. Okay. With the way that it's going, I volunteer at the hospital, so I can see how that area is developing. I can foresee myself coming back. With Camila, if there's a position still available by the time I'm done.
She might have a conglomerate by then. You never know.
Yeah. Or if there's a surgical position open at the hospital. They have just kind of a little bit of a story. I had a family member who had surgery, and my family did all this research regarding who's the best in the nation to do that surgery, and it turns out that surgeon was here in Yuma. So it really is, Yuma I think is really underrated. They do have a lot of capabilities in terms of medicine. So yeah, again.
We'll definitely let Dr. Trencher know about what you just stated. I think he'll be glad. We'll make sure he's on our board.
And I wanted to touch a little bit. I know you've touched on your internship experience, but just so that other students are aware of what was the day in the life of an intern at YOPT? Like, what were some of the responsibilities that you were doing while you were there, and what were some of those skills? I know you mentioned communication, but maybe what are some of the technical skills or any other skills that you learned throughout your internship?
I think from like like a regular day, it was kind of just for me. It was at the beginning of the day, I would help bring in patients from the waiting room and get them started on their exercises. I helped a lot with preparing therapy treatments. So, for example, I would prepare heat packs and or bring the cold packs from the freezer to the physical therapy techs. And in terms of technical skills, I think the general like knowledge of your body, kind of like what muscles, where muscles are located, where muscles are located, and kind of like what those muscles do, kind of helps. And in terms of exercises, kind of just knowing what those exercises provide to those muscles.
So it was, to add to that, I think that's great. Everything we had him do with patients and talking to patients and kind of taking a look at, everything that is part of a program. Mm-hmm. It's important for them to know, not only in patients with chronic, illness or with pain, but also the ones that have just had surgery, and kind of how, hey, at first it's going to be very basic, very light, and he also got to sit on a few evaluations with me as well with new patients and kind of see, hey, what does that process look like? What's that interview? What's that subjective part? What I'm doing with people both in English and in Spanish speaking communities. So kind of what that process is like as well. And then there was a couple diagnoses that I threw at you that I had him, hey, look this condition up and tell me what that's about. Next time we'll talk about it. And he was on top of it with these tasks that I gave him, little homework assignments. And I told him, remember that you're going to see it again in the future if you pursue medical school and things like that. Mm-hmm.
So we're almost wrapping up here, but I want you to put Camila on the spot here. Ask her whatever you want to ask her right now in terms of physical therapy, what your aspirations are, or what have you about the work that you did, or anything you may want to know. I mean, right now is a perfect time.
Well, I think throughout the internship, I kind of had a few of my questions answered by Camila. But Camila, one question I did have for you is, where do you foresee physical therapy in terms of kind of medical practice? Like, where do you see it going into the future?
That's a good question. It's hard to say because, every single year our practices are advancing in different ways. You've seen some of the things that we do with our patients in the clinic with advanced manual therapy techniques. We do cupping, dry needling, all this other stuff that helps kind of break certain barriers and when people plateau. I hope to see more changes in the relationship between certain prosthetics, orthotics, kind of like the robotics aspect of, hey, having patients have access to these devices that are up and coming, things that you see in conferences to help people with mobility. So I'm excited about that, about the whole AI aspect of mobility and getting more function out of individuals. I'm hoping that big tech companies invest more in healthcare and getting people moving. That's where I would like to see kind of the future and how PTs manage this. I'm not scared of AI taking over my job. I'm excited to partner with these companies or, patients that have these devices and learn how to use them and get them, functioning and moving better. So that's a really good question.
Can you both of you answer this question? Because I think we all do this, and we have a habit of Googling it or ChatGPT and now AI type, right? So we self-diagnose from the internet or ChatGPT. From both of your experiences, where do you see? I think that's going to continue, right? But I want to learn a little bit from Andrik and yourself as well.
Right.
Now that you work there as an intern, and then you see the self-diagnosis of Google and ChatGPT, were they right? Was ChatGPT or Google right?
I think to an extent, ChatGPT and Google can be right, but it can never always be right. I mean, every case is different. I think ChatGPT and Google, if you put in every specific symptom, then yeah, they could be right. But you could have some minor difference and ChatGPT won't be able to get it.
I think that's a very good question, Jerry. Right? It becomes tough when I can't formally diagnose patients. Of course, only the physicians can do that. That's another major difference. I can put a certain type of movement diagnosis that we work off of, but definitely when it's a specific diagnosis that I'm given, I can't really mess with that. I have to follow the doctor's order. But that's really interesting because I feel like people, there are found and there are studies that express how physicians can be a little bit biased and can be grouping patients in particular ways that, hey, they miss a lot of stuff. And it's not a perfect system. And humans make mistakes. But machines also, I think they're not there yet, whether they'll be there in the future, like Andrik says, or if you're very specific and you put every single symptom down, it could catch it potentially, but so can humans, right?
Yeah.
That's true.
And I know we had Andrik ask any question that he wanted to you, but I'll kind of open the floor for you, Camila. Do you have any questions for Andrik or for Jerry and myself?
Yeah, I actually have a question for both.
Okay.
So a question I had for Andrik is, this is kind of my first experience, not necessarily with yourself, because I've had a couple other interns with Elevate, but this is my first experience having an internship kind of relationship or an interns coming into the physical therapy world. So what's something that you learned in your 2 months that you think that we could do better or would give you maybe a little bit more of an edge or a little bit better experience?
Ooh, I like that question.
That's a good question. I don't know, because I feel like you guys did really good.
You can think about it.
You can think about it. I'll circle back to you. And then for Jerry and for Melina, a question I had for you two is, ever since you guys started this program and kind of not only including the internships, something that you guys have learned from them, but also in terms of the other projects you have going on, do you guys see kind of the benefit now or in the future of where you want to take these different ventures?
Wow, good question on that. They're really good questions. Been asking great questions.
Mm-hmm.
Yes, I think we're exploring other major programs, but with the internships, we definitely want to continue. We did apply for another grant, and the reason I was mentioning about the barriers is because that grant itself is specifically for students with low income or high barrier type of students. We want to expand it. We want to explore it, what possibilities there will be. We're still seeking funding. That's one thing that we're struggling right now at this point, just because of kind of a reset that everyone's doing. So we want to continue it. And actually, right now we still have maybe 15 students, maybe 20. We just went to I just went to a meeting, and there's other students that want to do interns, and they all want to do it as an experience, not necessarily a paid experience, because right now we don't have the funding. But in the future, obviously we want to continue funding, but we want to make it bigger as much as possible. We just need industries to open up the doors, especially on the STEM type of careers. Those are the ones that we sometimes struggle with, making sure that industries do open their doors. And we understand there's liabilities and other areas that we cannot just put interns just specifically because of that, but we want to explore it and make it bigger. Yeah, from science, computer science, to aerospace and defense, biotech, biomedicine, ag, clean technology, artificial intelligence, software development, logistics. So all that is where we want to put our students into internships.
I think the internships program, we capture a good range of students, right, from like the ages of 16 to 24 roughly. But we've also been partnering with other organizations that are bringing like camps here to our area that might also kind of be applied to other age groups. This summer we helped with like we went and presented at a space camp at an elementary school. We've helped with a cybersecurity camp. So I think continuing, I would like us to kind of expand on those programs, also having a larger reach to other students, both elementary and middle school. But yeah, like Jerry said, I mean, we want to continue this program, want to continue to grow it. And then I would also love to see just adding some kind of those camps or maybe even getting to an opportunity where we can certify students for different types of things, whether that be drone pilots and stuff like that. So those are some other programs that we would like to continue to expand.
There's been some research of where do you start, right? It normally starts in elementary, right? The 5th grade, 6th grade, you might push at that point, maybe even earlier. The schools have done a great job. It's just that something happens between maybe your 8th grade down to your 12th grade, right? Not necessarily at the high school level, but there's a lot of things that could happen at that age. And so, and they do a great job in terms of pushing STEM, but sometimes it's not for everyone, which we understand. But there's jobs in other areas of technicians that we want to explore. We want to grow this area. We want to, the demographics needs to change.
Yeah, and I think that's excellent that you guys are working on that and trying to expand and have all these things in the works, because, you know, out of the 3 interns that I've had, all 3 of them have been excellent, and I've been able to hire 2 of them. So it's just, we talk about this all the time, Melina. It's just incredible for myself, my business, kind of what we're trying to do as a company. And so I really appreciate that too.
Oh, thank you very much.
I was going to add, you beat me to it, Camila, but I was going to mention that, we're really grateful for the partnership that we've been able to establish with YOPT, because you've hosted 3 interns already. Mm-hmm. Like you mentioned, 2 of them you've already hired. Andrik, you're still in high school, so it's your hours and the availability are different from those that are already in college. But just wanted to really say thank you, because all 3 have had just, great experiences, have provided us with great feedback. I wanted to just hear from you, if you would talk about your experience kind of hosting the interns, right? Because sometimes people are hesitant. There's business partners that are like, they're not sure. They're worried that maybe the students aren't ready enough, or they're not, mature or professional, and they are concerned that they're going to have to, it's going to cost them more time to train them instead of being able to count on them as like another employee. So can we get like a nice little testimonial from your perspective on the internship program?
Yeah, definitely. You guys can. I think that from the get-go, the screening process / interview process that you guys do with them is excellent. I feel like I don't really have the need to have that kind of talk with them. I think the professionalism is there from how they present themselves, physically looking good, their communication skills as well. So I think I noticed that from our first intern, actually, like the timeliness, the, dependable kind of attitude, and also taking into consideration that it's just an intern, right? Mm-hmm. It's not, you're not hiring this person, you're not paying them. If something happens, or there's an emergency or something like that, or they can't come in a certain day, it's no big deal because it is an intern. So treating them as interns is very important, but also seeing the growth, kind of having this light expectation, and then seeing the growth just in a matter of weeks, and seeing them engaging with each other, seeing you ask questions, and also, them engaging with you, asking questions. Managing people is not as scary as people think. And so especially when we're dealing with a younger population, kind of, the teens to the 20s, it's like they are willing to learn. I think every generation has gotten a bad rep for certain things, but I'm very well invested into the Gen Z population, because they want to get experience. They want to work. They want to kind of figure it all out, just as generations before them. And they want to, follow a path into a career that they truly like, and they truly want to be there. So when you take things lightly, it'll grow, and you'll give them that opportunity to grow under the right condition. And so when that happens, it's great, because then that's a future employee as well. And that can be a benefit to your business versus hiring someone and not really knowing, in a couple of weeks if it's going to work or not. So for us, it was kind of hard starting out, because I actually hired a PT tech within the first, couple of weeks. We noticed it wasn't going to work. She wasn't dependable. And unfortunately, we had to let her go before it turned into more and more problems. So kind of, working off there, it's kind of like, okay, kind of having an open mind, having this internship. I've told you before, for me, about learning and being that opportunity and giving back to the community, that's what it's all about. So, having the opportunity to show them what PT is about, that is the best thing that you guys can do for this community, and continue to do it and continue to seek out those grants is great.
So business partners, don't be afraid to open your doors.
Yeah,
we have
definitely.
We have great talent here in our community, and we have a lot of young individuals they're hungry to get experience, and they're eager to learn from you and kind of seek your mentorship. So please keep opening those doors to our youth.
Yes, they need the soft skills, and for most of them, within a week or so, they start getting it right. So just give them that opportunity. Yeah. But I don't want to leave you hanging.
You think about your question?
You were thinking. I was
gave them time.
So okay, to answer your question, Camila, like I said, you guys did a really good job about facilitating our internship and giving us the experience to learn about physical therapy. The only thing I would change is, I would say something I kind of kind of thought I would have done is like maybe a hypothetical case. Like, how you would do having research on the different conditions that would come in.
Yeah.
I would maybe have the interns do the hypothetical case. So you have them develop their own plan, like you would when you would evaluate one of the patients, and kind of walk them through, like, this is their injury, this is what their injury this is what their injury means and how it affects their body. How would you treat it? I know you had me do some exercises with one of our patients, but maybe like a full run through. You give them some kind of injury, patient walks in, demographics and all, kind of just really involve them in the physical therapy world.
Yeah, that's good feedback, Andrik. Thank you.
That's great. Thank you very much. I appreciate it. And I want to thank everyone. I want to thank the participants, obviously. I want to thank the listeners. Please read, view, like, subscribe. And we are at YouTube, Spotify, Apple Music.
And Amazon Music.
Amazon Music as well. So I want to thank you very much. And please, if you have interest in sponsoring anyone out there, please look us up at elevatesouthwest.org. Thank you very much. Have a great day.
Easy.
Thank you.